Last time, we talked about how Western drugs and even natural supplements all follow the same logic: one ingredient, one target. TCM does the opposite. For something like cancer support, doctors build a whole formula: emperor, minister, assistant, envoy, a coordinated team of herbs custom built for one patient. So today, can that ever pass a clinical trial? Let's get into it. Here's what it takes to prove a Western drug works. Fixed ingredient, fixed dose, randomized, double-blind, large sample size. You need to prove that this pill at this exact dose produces this statistically significant effect across a big group of people. And for that to even be possible, the drug has to be identical every single time. Same batch, same molecule, whether it's going to patient A or patient Z. That consistency is the whole foundation of the test. Now here's the problem. TCM formulas do the exact opposite of stay consistent. Two cancer patients, both post-chemo. One has what TCM calls Qi deficiency, the other Yin deficiency. Completely different formulas. Same patient, week 1 versus week 3 of chemo. Different symptoms, different formula. Doctors adjust the herbs and dosages as the body changes. That's called treating based on pattern differentiation. And it gets even more extreme. The same cancer in two different patients might get two totally different formulas. Meanwhile, two different diseases might actually get a similar formula if the underlying imbalance looks the same. So the prescription was never a fixed product. It's something the doctor builds fresh based on exactly how the patient looks that day, tongue, pulse, symptoms, all of it. Here's the core conflict. Drug trials need every variable locked down. TCM's entire logic is one person, one formula, constantly adjusted. The variable is never locked, so trying to squeeze it into a framework built for fixed, unchanging inputs, that's a mismatch from the start. Not because TCM is unscientific, but because the two systems are answering different questions entirely. Here's an analogy. Imagine you take an orchestra built specifically for one performance, break it into 100 solo musicians, test each one alone, and go, none of them are that impressive solo, so the orchestra must not work. That's the mismatch. The coordination and the personalization is the value. You can't test it by breaking it apart. This doesn't mean TCM is untestable or beyond science. It means if we only isolate one compound, run a double-blind trial as our measuring stick, we might be measuring the wrong thing entirely, because that's just not how the system was designed to work. Two different frameworks, two different starting assumptions. Neither one is automatically wrong. They're just not asking the same question. Curious about how TCM decides which formula fits which patient? Drop a comment. That's next.